Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment of the show, I'm going to begin a series on cirrhosis of the liver. The last few weeks, I've been talking about different parts of the GI tract, but it is natural progression that I now begin to talk about cirrhosis of the liver. Worldwide, there are 500 million people with cirrhosis of the liver, and in this country, there are 5.5 million folks with cirrhosis of the liver, and every year, 25,000 people in this country die because of cirrhosis of the liver. It's a very, very serious problem. The liver is an indispensable organ. This is right here. This is the human liver right here. The liver is the big detoxifier of everything that we inhale that get into our bloodstream, everything we drink that get into our bloodstream, everything we eat that get into the bloodstream, good or bad, must go to the liver eventually for it to be detoxified and or processed in one way or the other. And the liver is also a big factory of different things, material that we need to remain healthy in the body. Okay, the list, of course, is extensive. You need the liver to process protein, even though the production of protein actually starts in the large bowel. It's ultimately through the ammonia pathway wind up in the liver, where you have to produce protein, etc. Glucose, which is something we all need in order to process, in order for our energy, as well as to be able to use oxygen properly and to perfuse all organs in the brain. You need that to be metabolized by the liver. Keep in mind, however, 15% of the glucose that is metabolized in the body is metabolized in the kidney. So the kidney is very important in the metabolism of glucose as well. That is why when the kidney is sick, the way we manage people who are diabetics, we do so differently, because we have to account for the fact that they're now producing less sugar. So therefore, we have to give them less medication to treat elevated blood sugar, etc. Now, I can sit here and spend hours talking about the different things that the liver does. I'm just giving you an overview. All the coagulation products that we need in order to remain, so that we don't bleed out, they're all produced in the liver, except factor VIII that is produced in the wall of the large vessels in the body, etc. So that's a big factory. When the liver is sick, in fact, one of the ways we determine how sick the liver really is, if the liver is incapable of producing prothrombin. We use that as an index, how sick the liver is or is not. Is the liver about to fail or not? It's not the height of the abnormal liver function test that tell us that. Rather, it is the prothrombin time that we use. Why? Because it is produced in the liver, and we use that as a very sensitive marker what kind of shape the liver is in. I mean, I can go on and on as I said, to tell you what the kind of stuff that the liver is responsible for. Suffice it to say, we cannot live healthy, we cannot live at all without the liver, nor can we live healthy without a healthy liver. Now, there are many, many, many things that can damage the liver, causing it to become cirrhotic. What do I mean by a cirrhotic liver? The liver becomes cirrhotic when it is the substance of the liver. This is the liver. The tissues inside the liver get damaged, as well as some of the tiniest little blood vessel within the liver of different calibers also become occluded because of different things that we do to our body that lead to this damage. Once the tissue gets scarred down because of a chronicity of the inflammatory process that's taking place inside the liver, the chronicity of it leads to the scarring. The scarring of the liver causes the liver to shrink, becomes cirrhotic. That's the process. Okay, now, the number one thing in the world that damages the liver is alcohol abuse, or alcohol itself. When alcohol is drunk in excess, and some of the book that you see over my shoulder, I've written all those books, but there's some chapters in some of them that has a chapter on alcoholism that fully explain the devastation that alcohol can do to one's liver. The second thing, of course, is obesity. Obesity is an epidemic in many countries, but more so in America. There are more obese people in America than more so than other developed countries across the world. Just today, the report just came out, as I read it earlier prior to coming to the studio, that the rate has increased again to the point now where 38% of American adults are obese. It is a horrible thing. When you put that together with those people who are overweight, together it adds up to 2/3 of the U.S. population's obese/overweight. But obesity itself, now it's 38% of all American adults. And they talk about the adults, they didn't talk about obesity and children and adolescents. This is also very, very high. And partly is because of the excess exposure to junk food. All this fast food, all of them, except for the vegetable part of it, the fruits part that some of these places sell, all these other things contribute to obesity. And I have lived in other countries, I have visited other countries where people would sit down for 2-3 hours enjoying a meal and a glass of wine and talking to each other as a pleasurable thing. Not so in many instances in this country. People just stuff themselves with food. They feel that this is their food, therefore they have the right to eat all of it. And they just eat not to satisfy hunger, they eat just to fill themselves with food. There are folks who do that because they have a psychological problem, they are addicted to food. Yes, there is such thing as food addiction. And as a result of that, they wind up becoming obese. They're not exercising. When you eat simple carbohydrate, which is main ingredient in addition to fat with all this fast food, the simple carbohydrate by necessity must go to the liver. When it gets into the liver, it has to be metabolized, broken down. Some of it is used for energy. The rest of it is put in storage, and some of it is converted into fat. Immediate energy, some of it just converted into fat, and the fat gets stored into the liver. So that's one way that the liver gets damaged. Okay, now you ask, how do you go from obesity to cirrhosis of the liver? Well, you go from obesity to cirrhosis of the liver because the fat infiltrates the liver. Okay, the fat infiltrate the liver. The infiltration of the liver with the fat damages the liver. That's right. You cannot be obese and have a normal functioning liver. If you are obese, by necessity, your liver is being damaged by the excess fat that the body cannot handle. The body will distribute the fat to the soft tissues, leading to more obesity, but the rest of it, liver cannot handle it. So it gets stored into the liver. The result in a condition called fatty liver. And fatty liver leads to cirrhosis of the liver, ultimately, because when the fat sits there, see, you got to understand something. When something sits inside of an organ, it has to be degraded. That's the process. It can't just stay there doing nothing. It's going to become degraded. As it is degrading, it's releasing material that is toxic to the tissue in which it is degrading, in this case, the liver. So obesity, I would say, is the second most common cause of cirrhosis of the liver, period. Now, the third common problem with the liver, of course, is hepatitis. If one has hepatitis A will cause acute liver disease, swelling of the liver, a whole host of other acute problems. And if you survive that through good medical care, which most people do, you wind up, that's the end of it. Because acute hepatitis A does not cause chronic liver disease. It's a transient process. It can cause liver failure. It can cause a whole bunch of stuff. But once you survive that through aggressive, superb medical care, that's the end of it. That's it. Okay? However, if you get hepatitis B, hepatitis C, hepatitis D, hepatitis E, all these different types of hepatitis can cause cirrhosis of the liver. Period. Okay, so that's the problem. How do you go from getting these different forms of hepatitis? Well, it depends on the circumstances. It depends where you live. It depends what part of the world you live. It depends what's your situation. And you could get it from blood transfusion. You could get it from being injected by a contaminated needle, etc. You could do it, get those hepatitis if you use a drug, intravenous drug. Okay, and most people who are, you basically cannot be using drug intravenously without ultimately wind up with one form of hepatitis or another, because the needles are dirty, and sometimes people exchange needles to inject each other, and you wind up with ultimately with hepatitis B, hepatitis C, D, or E, blood transfusion, contamination during surgery, God knows what. All these things can happen. So there are many, many ways people can get hepatitis. I have the book, I think, I don't have a copy of it with me now, that came out earlier this year, The Best of Clinical Medicine for the 21st Century is the title of the book. There are chapters there on all the different hepatitis that I just mentioned. You can get your hand on that book, you should be able to read all this stuff if you are interested. Okay. Now, another common problem, more common than people realize, is hemochromatosis. What is hemochromatosis? Hemochromatosis, primary, there's primary hemochromatosis, there's secondary hemochromatosis. Primary hemochromatosis is a very common problem associated with some hereditary issues that I will not bore you with, that people can have, that develop. And now it has even become more complicated, because now we used to think that it was just the one abnormality that used to cause it. Now, as of 2003, it's been published in the literature. There are 5 different ways, 5 different abnormalities that can cause hemochromatosis. Way back when I just started in medical school, there was a bunch of stuff being talked about, something called African iron overdose, African iron overload, which turns out to be 100% bogus. Millions and millions of dollars have been thrown away by giving people grant. Some folks have become, quote, famous by proposing this nonsense theory, because African people of African heritage had elevated iron, primary hemochromatosis. There was no way these people can have the same disease that white folks have. So therefore, they had to come up with some bogus reason for it, and they invented this garbage, which is exactly what it was. It turns out, now that we know, there is a product that is produced by the liver called hepcidin. There's another product produced by the wall of the stomach here, duodenum, called ferroportin. Ferroportin's job is to allow absorption of iron. The job of hepcidin, which is produced by the liver, is to control the action of ferroportin right here. Now, once they lower the level of hepcidin, the higher the activity of ferroportin, hence overabsorption of iron. It turns out that that's what was going on. You can't make these things up. Granted, the science was not known at that time, but now it is known. So that's most likely what was causing these individual black folks, people, other people of immediate African heritage, because everybody is from African heritage, but immediate African heritage, like I like to mention it, develop hemochromatosis. I was one of the very first person in the world, I suppose, to have had a black woman in my practice that I diagnosed with primary hemochromatosis, having nothing to do with hepcidin or ferroportin. It was, in fact, the same abnormality that Caucasian folks have, and this disease started from Scandinavia, through France, through Canada, and to North America. Okay, so it is amazing that things that are being shown, some of the stuff that we were taught, some of the stuff that we actually believe were so bad and so bogus, it is unbelievable. So therefore, primary hemochromatosis, and you have even more folks in the world with secondary hemochromatosis. I will list to you some of the diseases that cause secondary hemochromatosis. Sickle cell disease, alpha thalassemia, beta thalassemia, hemoglobin C disease, all these different abnormal hemoglobins, of which there are many, and I've listed them in the book that I just mentioned, because I did a chapter, I have chapters on all of these things, because these people have hemolytic diseases. Because they have hemolytic disease, by necessity they have to dump iron into the bloodstream when they hemolyze. Well, where do you think this iron, the excess iron, go? It stays, some of it, it is so much of it, most of it stays in the bloodstream, the rest of it gets stored into the liver, infiltrating the liver, causing, as the iron degrades inside the liver, it releases free radicals by necessity. And the free radicals is one of the most toxic stuff that can happen to any human tissue. So it damages the liver. So both primary and secondary hemochromatosis can cause cirrhosis of the liver. Okay, now there are a whole host of other autoimmune diseases across the world, 100. All these things cause folks to hemolyze as well, having nothing to do with the other stuff that I just mentioned. So I want you to imagine why there's so many people in the world that have cirrhosis of the liver, 500 million. It is not just because of alcohol or obesity and so on. It's because of all these other things that I'm just about to, that I'm talking to you about. So you have primary hemochromatosis, secondary hemochromatosis, all the autoimmune diseases. And then you have all these chronic inflammatory diseases. All chronic inflammatory diseases cause iron to be elevated in the bloodstream. All inflammatory diseases, be it, we just name it. If it's lupus, if it's scleroderma, if it is chronic osteomyelitis, all this, everything that is chronic in nature that causes inflammation prevents the transferrin protein from taking the iron from the bloodstream to carry it to the bone marrow to produce new red blood cells, to incorporate into early erythroblasts to produce red blood cells. All that time the iron is backing up in the body. What do you think the iron is doing? Some of it backs up into the liver, also causing damage to the liver. I mean, I can go on and tell you all these incredible things that are going on that can cause cirrhosis of the liver. Cystic fibrosis, primary sclerosing cholangitis, primary biliary cirrhosis, Wilson disease, lupus I just mentioned, inflammatory disease, mixed connective tissue disease, inflammatory disease, glycogen storage disease, parasitic infestation. Now, you know, there are 100 millions of folks into the world that are infested, billion that are the world have 7 billion people of it. 1.1 billion of these folks live in Africa. 4 billion live in Asia, different part of Asia, with all sorts of different parasitic infestation taking place there. So you can well imagine the amount of people who have parasitic infestation throughout the world, and all these folks can ultimately wind up with liver disease. So cirrhosis of the liver is the result of a multitude of different diseases that human beings are afflicted with. So when one sees a patient that one suspects has cirrhosis of the liver, then depending, this is where ethnic associated racial sensitivity in the practice of medicine comes into play. Because we're now living in a world where people are traveling back and forth throughout the world. I have people from all over the world in my practice, just name it, I have seen them. So therefore, you have got to understand different parts of the world are afflicted with different diseases, more so than others. So when you see these individuals in your practice, you must quickly put your thinking hat on by not using the one model that you learn in medical school, which is quote, the Caucasian model, to try to apply it to someone who comes from Africa that you're dealing with, someone who comes from China, someone who comes from Japan, someone who comes from Scandinavia, someone who comes from the Caribbean or the Americas. You have got to know these things. If you don't know these things, then you have a responsibility to refer such patients to people who are more familiar with their background in terms of where they come from, the different diseases that maybe afflict them. Otherwise, they're going to continue to have the symptoms, and you're going to spend millions of dollars trying to figure out what ails them, and you may or may not succeed. It's just like you're in the dark room, there's no light, you're trying to go there to find your way, when in fact, if you familiarize yourself with the ethnic background, the religious habits, the dietary habit, because the religious habit almost always dictate some of the dietary habit, and so on, you might be able to much more easily arrive at a diagnosis that can help these individuals. HIV/AIDS, that's right. AIDS is known to affect the liver, as you can well imagine, very frequently. So you have to be very thorough to try to evaluate the patient very carefully. I cannot sit here and try to detail to you what each of these conditions, how it goes about causing the liver disease. I'll be here forever. I'm not going to do that because it will be too extensive. I'm just giving you an overview of what can happen. So it is really very important to realize how serious cirrhosis of the liver is. 500 million folks have cirrhosis of the liver per year. It's one of the most common causes of death worldwide. In this country, 25,000 folks die every year because of cirrhosis of the liver. And we cannot survive without a healthy liver. The liver has to be functioning very well because the liver has to do so much for us. When the liver is sick, we're sick. So it is a very important thing to keep in mind. Listen, I'm going to stop here. And next week, I'll begin to talk about some of the symptoms and signs of cirrhosis of the liver. Until such time, keep watching the show. This is Dr. Alcena saying so long and bye-bye.